So let's take a minute to familiarize ourselves with the equipment that came in our at-home drug testing kit and just get an idea of what each piece is supposed to do and the purpose of everything. We've already seen the at-home question and answer test instruction handbook, which is a much more in-depth piece of text than I have led on. So please always be sure to read instructions thoroughly when using an at-home health product. This is the at-home urine collection kit. As you can see, it's a approximately 100 milliliter cylinder, and this strip at the bottom is very important. This is a temperature strip, and in a freshly produced sample, it will generate a temperature between 90 and 100 degrees Fahrenheit, representing the fact that the urine has just come from a body of regular temperature. If you're to collect a sample from somebody else who may or may not be messing with the sample, anytime the urine leaves your particular custody, you have no way of knowing if it's been dumped out or swapped in. And commonly people will obtain urine from a person they know to be absolutely clean and free of any sort of illegal or prescription drugs and try to swap it in for their own. And what this temperature strip will tell you is whether or not the urine has come fresh from the body or is cold due to the fact that it has been out of somebody else's body for a while. The color green in the strip equals that the sample's at temperature, and if the sample is tan on the strip, then that means the sample has dropped below 1 degree Fahrenheit and it could possibly not be your test subject's sample. Right here we have the at-home test strip. 1, 2, 3, 4, 5. 1 is methamphetamines and or ecstasy. 2 is amphetamines. 3 is THC, which is the active ingredient in marijuana. 4 is cocaine, and 5 is opiates, which are, again, heroin or any number of prescription pain-killing medication. And this test is timed, so once it's dipped, you'll see that there's a mark to tell you when the result is ready, and then there's a mark to tell you when the result has expired. And should you want to have the further confirmation done on your urine sample, you would then place another sample into this vial, take this personal identification number for yourself, attach it to the booklet so you have to call in and identify yourself with the sample. This is an anonymous process. That's what makes this process anonymous, is the pin is attached to the sample itself. And check off 1, 2, 3, 4, 5 what drugs you want the urine screened for. Drop it into the bag, follow the little handy checklist on shipping confirmation. Cap it up tightly. You don't want a urine to get loose. Box it up, attach the proper postage, and mail it off to the laboratory for further confirmation of drug use or abuse, or of no drug use or abuse.